Blind in 45 days. This is the story of a 30-year-old woman. A 30-year-old insulin-dependent diabetic was diagnosed to have high-risk PDR. She underwent pan-retinal photocoagulation. She went to the doctor on time. Her blood sugar was well controlled for at least 6 months, and she had no other problems except for blood sugar. And the visual acuity was 20/20 in both the eyes at presentation. Doctor on time. But the treatment given to her was just laser photocoagulation. I am trying to say that just laser is not enough in diabetic patients. Now, if you see, the right eye of this lady has NVE. There are florid vessels growing over the retina. The left eye has fibrovascular proliferations, and on a 3D view, there's actually a slight pull on the retina. Traction is developing. Lots of new vessels are seen over the retina. 45 days later, this was the condition of her left eye after laser photocoagulation. We must understand that just laser is not enough in cases of diabetic retinopathy. There are times when you need to decide to operate and to remove the vitreous, which is causing the pull on the retina. Now, this lady had a lot of traction and bleeding, and this was an inoperable tractional detachment. So, I recommend you think on these lines. Early vitrectomy may be indicated in young diabetic patients, the ones who have aggressive proliferative retinopathy, even in the presence of normal visual acuity. Pan-retinal photocoagulation alone may only aggravate the disease and cause increased traction on the retina. A taut posterior hyaloid in the presence of adherent fibrovascular fronts may be an important indicator for early vitrectomy in PDR.